Okay, so for the assessment of a patient with a left arm AV fistula, which could be located on the forearm, but I've seen them generally on the upper arm, and it consists of a vein and artery grafted together to allow for access for dialysis. And for a patient with a fistula on the left arm, you should never take a blood pressure, don't do blood draws, don't start IVs on that anywhere on that arm, because it could damage the fistula or the veins. And when you assess the fistula itself, you want to check for a thrill, which you'll feel through the fistula, and you'll listen for bruit, I believe. Yeah. So the thrill is the tremor running through the fistula with the beat of the heart, and the bruit is the sound, the swishing sound that should be running through the fistula. If you can't hear the bruit on the fistula, or if it's really weak, that would be indicative of, if you can't hear it, then it's likely blocked, or if it's really weak, it's potentially could become blocked, and that needs to be reported to the healthcare provider immediately, as they may need to create a new fistula, or if they can, they could potentially save the one that's been blocked without it needing to create a new one, which would be good. And if you're a patient that's undergoing dialysis, make sure you weigh them before and after dialysis. You're going to want to monitor their serum electrolytes frequently, because dialysis tends to take a lot of those with the waste products and fluid during dialysis. I don't know where my camera is. And other than that, monitor the patient for signs of infection or phlebitis, possibly from the needles for dialysis. Not that we handle that. That's done specifically by dialysis trained nurses. And other than that, just make sure that the arm isn't constantly crooked, that there's no damage or bruising around. Check for bleeding and blood pressure, obviously on the right arm for the blood pressure. Check for bleeding post-dialysis. Check for large blood pressure drops. Make sure you assess how conscious their orientation. Make sure that's normal. And other than that, that should really be it as special considerations for a patient with a left AV fistula, left arm AV fistula.